Has your doctor placed an order for you to have a CT scan? Are you overwhelmed or anxious because you've never had a CT scan before? Are you worried that you will be inadequately prepared? Well, if that's the case, you've come to the right place. I will walk you through what to expect and how to prepare for your CT scan in 3 easy steps. My name is Amy Giese. I am a CT tech and I have been a tech for 18 years. I currently work third shift at a local hospital, so I am sharing with you my wealth of knowledge. So let's start with what is a CT scan? Computed tomography, also known as CT, is a series of x rays and computer to produce a 3D image of soft tissues and bones. What to expect and how to prepare for your CT exam. I am going to explain this to you in 3 easy steps. Step 1 will include 2 to 3 days prior to your CT scan. Step 2 will be everything on the day of your CT scan, and Step 3 will be immediately following the scan to the 3 days after that. First, do you have a contrast or allergy to iodine? If you do, you need to contact your doctor and let him know that you have an IV exam ordered for CAT scan and you are allergic. In this case, the doctor will send a prescription to the pharmacy, likely for a steroid prep or antihistamine, at which point you need to acquire those medications and take them at the designated times. Some preps need to be started 13 hours prior to your CT scan, so plan accordingly. Kidney function lab work. Why? This is a big one. Concern for development of contrast-induced acute kidney injury for contrast exams. We don't want to give you any kidney injuries, so we have to make sure your kidneys are functioning properly before we give you any contrast. Who needs to have this done? Anyone who is age 60 or older, if you have a history of renal disease, if you are diabetic, if you're receiving chemo treatments or taking metformin or metformin-containing medications. So contact your doctor. Your doctor will place an order for you to have lab work done. You'll need to go to the lab and have your blood work done 24 hours prior to the CT scan so that the lab can process your blood and put those results into your chart. Are you pregnant or think you may be pregnant? A CT scan of the abdomen or pelvis carries a very slight risk to the baby. So if you are unsure if you're pregnant, go ahead and take a pregnancy test. And if you are pregnant, contact your doctor. He may be able to change your order to an ultrasound or an MRI. And if you're breastfeeding, this is only for IV contrast. Manufacturers of IV contrast advise that mothers should not breastfeed their babies for 24 to 48 hours after IV contrast is given. So you may want to pump some additional milk ahead of time. Day of the exam. What do you wear? Make sure you wear something comfortable, but please stay away from anything with zippers and metallic bedazzlements, belts, clips or clasps like a bra or zippers on jeans. Avoid all that. Do not wear any jewelry. You will potentially have to remove earrings, necklaces, navel, nipple, facial, and other body piercings, so just leave it at home. Make sure you bring photo ID, a copy of your physician's order, and your insurance card. You will be receiving oral contrast if you have an abdomen or pelvis exam. There's various types of oral contrast available. One of the more popular ones is the ReadyCat smoothie. It's like a white barium drink. Or often now we're putting IV contrast mixed in with water or some type of a Breeza is another one. It's a flavored beverage. And this is used for CT exams of the abdomen and pelvis. And this helps to highlight the intestines. IV contrast. This is very thick. It's like pancake syrup. It's clear. And you will need to have an IV started if you are having IV contrast. So the contrast helps to highlight blood vessels and enhance anything that has blood flow. So when it comes time for you to get that injection of the contrast, the tech will come in the room and they'll hook you up to the injector and you'll receive that injection. And of course, you may feel hot throughout your whole body when you receive this injection. It's like an intense hot flash. You may also get a metal or metallic taste in your mouth, and you may feel like you're wetting your pants. But I promise, you do not wet your pants. So immediately following your CT exam, we're on to step 3. Your imaging is complete. The technologist or nurse will come in and remove your IV and put a bandage over it, at which point then you can change into your clothing if you had to put on a hospital gown, and you can leave. Once you leave, make sure for the next day to 2, maybe even 3 days, you drink lots of extra water. This will help clear that contrast through your system. The contrast will come out in your urine. It'll be clear. It'll also help keep your intestines moving if you had oral contrast. A radiologist will read your CT images within 1 to 3 days and provide results to your ordering physician. Please note, CT techs cannot give you any results and they cannot tell you anything that they see on the CT scan. So don't ask. They could lose their license if they do tell you. That's a real thing. So wrapping up, let's review what I covered. Step 1, discuss the events and prep of days prior to your CT exam, and this included contrast allergies, kidney function lab work, hydrating, and when you should not eat, and finally, pregnancy and breastfeeding. Step 2, the day of your exam, covered the prep and events the day of your CT scan. I discussed what to wear and not wear, what to bring with you, oral contrast, and IV contrast. And the final step, step 3, I discussed what happens immediately following your CT exam through the next 3 days. This included completion of the imaging exam, IV removal, changing into your clothes, and leaving the facility. I also talked about importance of drinking water after your CT exam to help your body remove the IV and or oral contrast from your system, as well as how long the results should take and where those results are sent. Thank you for watching my presentation. I hope you now have a better understanding of what to expect and how to prepare for your CT exam.